Well, welcome everyone, and thank you for your interest in today's IHE Pathology and Laboratory Domain Update webinar. I am Mary Kennedy, Director of Clinical Informatics Initiatives at the College of American Pathologists and the Primary Secretary to the IHE Pathology and Laboratory Medicine Domain. Our speakers today are Riki, Merrick, and Raj Dash. Riki Merrick is a co-chair of the IHE Pathology and Laboratory Domain, also known as PaLM. She's a licensed physician in Germany, received her Master in Public Health from the University of California, Davis, when she started working on HL7 Loinken SNOMED. For the last 9 years, she was a consultant for the Association of Public Health Laboratories and is now serving as Staff Informatics Program's lead terminologist, providing implementation assistance for electronic data exchange for influenza surveillance, lab reporting, and lab notification initiatives. She also worked with NIST on the development of test cases for lab-related message validation tools. She participates in several national vocabulary harmonization projects in the laboratory and public health domains, in leadership roles in HL7 Orders and Observations Working Group, and the Lab Messaging Community of Practice, as well as the laboratory-related SNI framework initiatives. Raj Dash is also a co-chair of the IHE Pathology and Laboratory Medicine. He is a pathologist at Duke University with training in cytopathology and informatics. He currently serves as the Beaker Physician Champion and the Medical Director for Laboratory Information Systems, as well as the Director for Laboratory Informatics Strategy for Duke Health Systems. He is involved in the research and development of medical terminologies and associated software tools for medical data mining and analysis. He has participated as a platform for CA Tissue Core and represented the National Library of Medicine as a member of the Technical Committee on SNOMED International. He served as chair of the International Pathology and Laboratory Medicine Working Group within SNOMED International and currently participates in the ONC Laboratory Reporting Tiger Team. He is active on a number of national committees serving the College of American Pathologists, including the Biorepository Accreditation Committee, the Informatics Committee, and the Clinical Informatics Steering Committee, which he chairs. I would now like to turn the webinar over to Riki Merrick.
Thank you, Mary, and thank you for that introduction. Welcome, everybody. I'm going to show you this agenda slide, and if you want to know any of the profiles that are of interest and the current projects that are of interest to the pathology and laboratory medicine domain, this slide's all you need in terms of knowing what goes where. So I'm going to give you a brief intro to IHE, just in case you're not familiar with what IHE is and what's special about IHE, and then the majority of this talk is going to be focused on the pathology, laboratory medicine space. I'm going to focus on the PaLM final text and some of the lab-related items, and then Raj is going to take over and talk about the anatomic pathology pieces, because that's his expertise. So as you've already seen, there's lots of acronyms everywhere. So when these slides will be made available, in the notes, I have the acronyms always spelled out. I've tried to also spell them out on the slides. However, in some parts, there's obviously space constraints. So there may be a few acronyms you see here or there that are not all spelled out. There's also a glossary slide at the very end for all of them. All right, so what is IHE? Well, IHE is an organization that takes the different standards that are out there and combines them for a specific use case. So what we're trying to do in the laboratory space specifically is to find situations where you need to exchange data, describe the requirements, and then go look for the available standards that are there and describe how they work together. So IHE is not a standards development organization, but it's an organization that uses standards that are developed by other organizations and puts them together to solve a specific problem. So some of the basic terms that you're going to hear throughout this presentation is an integration profile. so that is the, describes the things and the data elements that need to get across during the data exchange. It describes how those are organized, but it doesn't give you any requirements on specific architecture. The actors are the systems involved in the transaction. So in my example here, we have an order results tracker that will receive a results transaction from the order filler. And I already mentioned transactions, so that's the actual data exchange. IHE started in 1998 and has been growing domains steadily ever since then. And you can see laboratory started in 2004, pathology started in 2006, and in 2016 we decided to merge because of the current overlap in technology, where the differentiation between techniques and instruments and methods used in the clinical laboratory are not that different anymore from the pathology lab. And so there's more and more overlap. And so we decided now is a good time to merge the domains. So now we are the pathology and laboratory medicine domain. So what's the IHE process? Briefly, you're defining your use case and you're figuring out your requirements. You're selecting the standards you're going to use. You organize them and write the integration profile. You have folks implement and test it at a Connectathon. And of course, the devil is always in the details. So as you know, when you implement something, even if you think of all the different things, you'll always find something that you'll need to improve. So you'll, give feedback to the integration profile and test it again and keep going. And ultimately, it'll become published as a final text. And Connectathons, I've already mentioned it, so this is where you can test your integration profile, where vendors come that represent the two actors of the transaction on either end and actually try to make their systems talk to each other. It's a week-long testing session, basically, and they're organized across the different continents. So the next one is in Japan in September of this year. The US one is in January of next year, and then in Europe is in April of next year. So that's the brief overview for IHE, and I understand we're putting together a video of all that background that'll be available, and hopefully you can find that afterwards. So what is the pathology and laboratory medicine domain scope? Well, we're talking about any data exchange, digital documents, structured data, images associated with services performed in clinical laboratories and pathology laboratories on specimens collected from a patient or non-living material. So that could be environment. We're also concerned with the automation of data exchange between the testing instruments and the data storage devices, and the representation of structured data related to specimen management and storage and reuse and custody tracking. Secondary use of in vitro diagnostics, so that's reporting to public health, for example, and to review data for research across time. And this year we expanded our scope a little bit and decided to include the exchange of structured data related to workflows for transfusion medicine around blood product receivers. So these are the IT systems in scope. I'm not going to list them all off, but you can see it's quite a few choices of actors that our profiles cover. So specifically, we have the final text, so that's everything that's in the technical framework, which was just published June 21st of this year, version 8 of it. And it contains quite a few of the different profiles, which I will talk about next. And then we have some profiles that are published for trial implementation, so those are being tested in Connectathons but haven't had enough exposure testing and feedback for us to decide to put them into final text. And so those are exchanges between laboratories and how to deal with exchanging graphics within the laboratory testing workflow for simple images, so that's more in the clinical laboratory space. If an instrument puts out a graph, for example, how to exchange that. And then in the anatomic pathology domain, we have the pathology workflow in hospitals, which is similar to the testing workflow in the clinical lab. We have the anatomic pathology structure report and a public anatomic pathology report to public health. Those are published profiles. All of these profiles are available with brief descriptions on the wiki, and so there's a summary page, and then each of the profiles itself has a wiki page also with background. So some people like the overall view better, so we have the profiles that are in final text with the green dot, the profiles we are developing with a D, and then the T's are the trial implementation. And here is a different view of how each of the profiles relates to the actors and organizations among them. So, for example, a specimen collection facility really deals only with the labeling, but the clinicians and caregivers and lab order and report management areas, they have to deal, of course, with the labeling as well as with the ordering and exchanging of laboratory results and orders. And then we're expanded to transfusion medicine, which includes blood bank. And we're working on digital pathology, which of course also includes the clinicians as well as the lab. So here is the 2017 cycle of what we've got planned. So you can see the PaLM technical framework number 8 was just published. We're planning to publish a digital pathology white paper at the end of the year. We're planning to have a structured reporting data elements and capture white paper in September, at the same time as we're publishing 3 supplements for public comments, which is the structured report, laboratory clinical communications, and the transfusion medicine related things, transactions. And then we have a face-to-face meeting in November